Good morning, friends. We have taken up the study of homeopathic remedy Spongia tosta, and we will recall its common name is roasted sponge, belongs to animal kingdom, and its family is Colenteriata. This remedy was proved by Hahnemann, and here we are dealing with part 2A PQR review in classical format. The text is mainly from Allen's keynote, and this is a very good revision for the homeopathic students, interns, house physicians, and other practitioners who would like to revise the medicine. As a tradition, we should be able to revise one medicine every day to keep up with the traditions of recalling rare in between the lines symptoms. Friends, I am Dr. V.K. Chauhan, homeopathic physician. We are talking about the classical format. What is the classical format and how and what are the intricacies of this format? Let us try to figure out first. So let us go to the organon, and if you go and see the aphorism 5, here Dr. Hahnemann gives essentials of case taking to achieve cure. You have to be so focused, whatever you do, it should be a orientation where you have not wasted time, but then you have invested time, and case taking, long case taking has got no meaning unless you know what you want to know about the patient and how you will come to know in order to cure. And very few simple things he tells us useful to the physician in the assigning him to cure. See, the central idea is your aim and objective is to cure the patient, but then the pathway is you have to take up the case. And there are particulars of the most probable exciting cause of the acute diseases, whether you are looking into the acute disease or chronic disease. So if you are looking at the acute disease, you need to know the exciting cause. That is your aim. And also the most significant point in the whole history of the chronic disease. And if you are looking into a chronic disease, then what is that significant history? Is to enable him to discover the fundamental cause, which is generally due to a chronic miasm. So all chronic diseases should be identified in the background which belong to the like psoriasis, psychosis or syphilis. And for that reason, if you are going to treat the chronic disease, then the third paragraph here tells us in these investigations, the ascertainable physical constitution, his physical attributes, height, weight, texture, skin, eye color, hair color, delicacy, muscle mass, rigid, fine, of the patient, intellectual character, whether he is intellectual person or he is having a dull mind, what kind of a mental attitude and aptitude he has, his occupation, mood of living, habits, mood of living, its habits, his social and domestic relations, his age, sexual functions are to be taken into consideration. In chronic disease, we treat the individual. In acute diseases, symptoms are fleeting and they are acute, they are going to be all right. So you have to pick up the most prominent symptom and patient remembers those symptoms. And he tells you the very first time what problems he is having. But in chronic disease, patient may not may forget many things. So it requires a good amount of investment of time as well as skills to undertake those particular hidden informations which patients generally do not disclose. So his occupation, what are the intricacies of his occupations are there, what kind of a mental tensions are there, where he is living, his environment of house, whether it is a damp house, where it is a very sunny house, and his habits, whether he is eating, what he is eating, vegetarian, non-vegetarian, alcohol, smoking, social and domestic relations. Social is his social life, and domestic life is his personal life. And according to his age and sex, you will come across the milestones what happened to his parents in that age group. Probably this patient will undergo the same problems. So you have to have that particular family history in mind, which also going to tell you about the miasm, inherited miasm. Sometimes people acquire the miasm due to their activities. So please remember, all venereal miasms are acquired miasm most of the time. So this is the idea which we are getting from Organon. And then we go to the Bonninghausen. The Bonninghausen has given 7 points which are essential to complete the disease totality. And the number 1 point is quiz. He tells us who. The personality of the individual. Let me know who is the patient. Whatever the symptoms you have brought is all right, but then who you are. So, who you are means your personality. Your personality, your individuality has two components, your physical attributes and your mental attributes, your desires, aversions, side affinity, thermal affinity, everything. And then he says what? Quid. Disease, whether it is a acute disease or it is a chronic disease, and what is the peculiar nature of the disease. Every organ system has got very different kind of a manifestation, so you should be able to understand that particular part, what you are suffering from. And ubi means where, what is the seat of the disease. It has got two considerations: seat of the disease, the miasmatic aspect, the fundamental cause, the miasm, the chronic miasm. If it is a acute disease, it is acute miasm, which is flare of sora. But if it is a chronic disease, then there is a sora in background, or there can be complicated miasms, soro-psychotic, soro-tubercular, like we have tubercular miasm or pseudosora. That needs to be understand. What is the seat of the disease you need to understand. And quibus auxilis or concomitants, apart from your symptoms, what accompanying symptoms you are carrying, what accessory symptoms you are carrying. If you could not have these, probably you don't have a good data, good patient data to select a good medicine. And then curve high, cause of the disease, immediate exciting cause. In acute diseases, exciting cause. In chronic diseases, suppression of certain diseases will lead to secondary and tertiary manifestation of those particular chronic miasms because they are suppressed. And Comado is modifying influence modalities, aggravation and amelioration like food, drink, weather, position, heat, cold, side, where which side you sleep, which side you find good. And seventh point is quando, when. Modalities means time modalities. So these are the 7 points. If you don't include in your case taking, probably you will not have important a, a wide perspective where you should be having to take up the very important things. You will be the masters of choice then, because you have lot of variety available. Choices are available because lot of information is available. And they are systematically available. So classical format, we include guidelines given in aphorism 5, and then we also include the information essential for every given case for achieving cure. Bonninghausen 7 points essential to complete the totality of disease picture. So it includes number one, constitution. Quiz, personality of the individual. So in constitution, what we are going to see? Somatic features, physical attributes, age, sex, build. And in psyche, we'll find what is temperament, what is mental state, will, understanding, emotion, love, hate, memory. All those things we are going to pick up here. And then second point or second heading will be causation. In causation, we have diathesis. Diathesis means indisposition, inherent indisposition to develop certain diseases. There are certain familiar diseases. So, ubi, seat of the disease. Intrinsic, they are miasmatic. Diathesis is miasmatic, more or less. And then we have another cause for miasm. Fundamental cause is sura. Primary cause is sura, and secondary miasms which were acquired later on, because first there was susceptibility, and susceptibility is sura. If susceptibility would not have been there, then other miasm would not have come and combined with sura. So fundamental cause, we know sura is there, which can create any kind of disease. But however, there are external venereal miasms which can come and combine, and they can create a complication of two miasmatic or trimiasmatic disorders. Then exciting cause is important. The fifth point of Bonninghausen curve tells us disease, exciting and maintaining causes, whether your mood of life, your food habits, you are not eating healthy food, you are practicing physically deteriorating kind of a actions, exposure to cold, exposure to rain. So everything, you need to maintain your physical integrity, you need to have wholesome food, you need to have 3 liters of water, you are not drinking enough water, you are not taking enough minerals. So then those causes, they also need to be known. They become maintaining cause. Exciting cause can be weather, chilled, trauma, must for acute disease. Exciting cause is must for acute disease. Characteristics, these are the symptoms. Disease, its nature and peculiarity. It is quid. And these characteristic, constitutional characteristics or disease characteristics to be taken into consideration. So characteristic physical generals, characteristic particular general, and concomitant symptoms. Cubilis auxilis, accompanying symptoms, they are also to be hunted down. And then once you have done it, you will come across a shade of remedy. And once you have in your mind, because you have constitution, causation, and characteristic picture, you will have a complete set of medicine in your mind. And for that, you have to have the relationship similar, most similar medicine. What is the best? Then what are the antidotes you have in mind? Then if you are treating him, then you will have to keep in mind what are the follow-up medicines you keep in line. General modalities are very, very important. They are seasonal variations. Commando and Quando is time modalities. Sometimes the patient is versus 4 to 8, sometimes patient is midnight, after midnight, before midnight, early morning. So these time modalities point out certain specific medicines. Then aggravation and amelioration is very, very important in general modalities. And predominant active miasm, on the basis of our information, you will be able to pinpoint what is the active miasm. And then you come to the posology, select the most suitable remedy and potency according to the susceptibility, age, sex, miasm, problem. It can be acute intercurrent miasmatic remedy sometimes. It can be a constitutional remedy, or it can be acute, subacute, or second prescription. So this is the information which generally we have. So let us go to now general information which is not given in Ellen's, we are going to pick up from somewhere else. So friends, I must tell you, to have this kind of a information in case taking, you need to have your materia medica should be reflecting the same pattern of your case taking, where it is very easy for you to match the symptoms. And for that reason, we should have this particular pattern. So number one is what we should know about the remedy profile. Here, spongia is a remedy for respiratory, cardiac, and thyroid functions. Apart from it has got also action on the genitals especially. Hmm. The kingdom, it belongs to animal kingdom, and its natural order is Colenterata. Habitat, sponge is a sea animal. The preparation, mother tincture is prepared from the roasted sponge. 20 grains of roasted sponge is dissolved in 400 drops of alcohol. Higher potencies are prepared from the mother tincture. And this remedy was proved, as we all know, by Dr. Henneman. An organ tissue affinity or sphere of action is very, very important. It acts on the heart valves, it acts on the larynx, trachea, bronchi, lungs, nerves, testicles, thyroid, lymph glands. Now we go to the Ellen keynote proper, and we are going for PQR review in classical format with some add-on information which is not given in Allen's. Please remember, this is a small bit of information I will keep on giving you here and there. Hmm. So let us see the first constitution. Who is the client? The client here, who is the client? Soma. His physical attributes. What are the physical attributes? Spongia is especially best suited to the diseases of children and women. So age is very important factor here. And sex is also very important factor here. Predominantly male remedy or predominantly female remedy. So it is a very delicate remedy, especially on tender people. Children and women are going to suffer. And what kind of a physical attributes they have? They have light hair, lax fiber, fair complexion, similar to bromium. So this is adapted to diseases of children. So it tells us the hidden indisposition, weakness, diathesis. It tells us diathesis. This single few words tell us diathesis and somatic attributes. Who is the person and what is his weakness? Thermal sensitivity, please remember, this patient is chilly, 2 plus chilly according to reverse Kent repertory. And side affinity, it is a right-sided remedy. In generalities section of Kent reverse repertory, you will find it has been assigned second grade position. We'll go to the psyche part. In psyche temperament, these patients are anxious patients, and mentally they are afraid of death. This is taken up from Kent repertory only. And sadness, mental depression, again we have going to refer to the Kent repertory here. Dreams. Now after mind we are considering dreams. Dreams are not usually given with all the medicines in Allen's keynote, but then we are going to pick up this particular part. And here the patient has anxious dreams, 3 plus, fire 1 plus, misfortune 1 plus, and visionary dreams 2 plus. Again, this section is coming from reverse Kent repertory. Desire, patient desires alcohol, cold drinks, and desires delicacies. Very important thing is desires delicacies. Aversion is for beer, and food aggravates is fat and milk. Spongia tosta, please remember food aggravation, fat and milk. So friends, we go to the causation section. And in causation, we find the diathesis and PQRS 1. PQRS 1 tells us it is wrongly printed here PRS, it is PQR 1 for the tubercular diathesis. Straightforward, author has given us the information that this is a tubercular background. Patient has got tubercular background and elements from Kent's generalities tells us that tobacco is going to aggravate spongia tosta. Let us go to the characteristic generals, and there is one symptom only which fits into the characteristic general 3A characteristic general feature. PQR6 worse after sleep or sleeps into aggravation similar to lachesis. This is the one generality I have. And rest of we have the particular generals. 3B reminds us for we are going to see particular characteristics. So in particular characteristics, throat. Above downwards we are going to travel. PQR7 tells us sore throat worse after eating sweets. Characteristic general, characteristic particular general and location throat. Now we go to the next symptom here in the neck region, and here you find PQR3 swelling and induration of the glands, goiter, bromium. This is characteristic particular general in especially for thyroid. And then PQR8 thyroid gland swollen even with thin with suffocative paroxysm at night. Characteristic particular thyroid. And PQR9 straightway author tells us goiter. Is not going into the detail, is a goiter straightway. Characteristic particular thyroid. So here 3 by 1, 8 by 2, 9 by 3. These three number tells us that three particular symptoms are dedicated to only thyroid gland. Number one, swelling and induration. Thyroid gland swollen so much that it has become reached to the chin. And third is goiter. So a author who has very sensitive in picking up symptoms, not taking up so much of a voluminous number of words, has given us three important symptom for one particular organ, one particular gland. This is the most important area we have to keep in mind. Now, next comes the male, and here the male spermatic cord is swollen, painful testicle swollen, bruised, squeezed, and after suppressed gonorrhea and maltreated orchitis. So there is a sexual STD. Gonorrhea is STD. So his sexual behavior, you can understand your patient is very uh, sexually active person and permissive person. Then he got the infection, then he got the maltreated. Because of maltreated, now there is a further complications. Initially there was gonorrheal urethritis, and then ascending infection went into the spermatic cord, and most probably it reached to the epididymis and testis. So it is a very long history. Already complication has sets up. So this is an element from maltreatment. When we talk about, as we have been talking about causation, and we have been taking into consideration diathesis and elements from where we have seen the tobacco was one cause which aggravated the problem. General aggravation was tobacco, but here elements from gonorrhea, maltreated gonorrhea had to be added over there. Next, we'll go to respiratory system. Now we see PQR4 awakens in fright and feels as if suffocating, as if had to breathe through a sponge. So generally patient who sleeps at night has got suffocative feeling, gets up and he has difficulty in breathing. Breathing through spasm means he has got difficulty not only inhaling but also exhaling. This is a very important symptom. So, this kind of a symptom can be present in many diseases. At times, it is in congestive cardiac failure where paroxysmal nocturnal dyspnea occurs, hmm, or it can be because of sleep apnea, to, or it can be because of sudden bronchospasm in case of severe attack, suddenly precipitated in the night hours. Second PQR 5 tells us every mental excitement or increases the cough. Aggravation by mental excitement. Respiratory system is the vulnerable organ and there is cough. And PQR 10 tells us great dryness of mucous membrane of air passages. So mucous membrane, we have throat, pharynx, oropharynx, nasopharynx, laryngopharynx, trachea, bronchi. Whole passage is dry as horn, just like cartilage. And PQR 11 again tells cough, dry, barking, croupy, rasping, ringing, wheezing, whistling. Everything is perfectly dry, no mucus rails. So, friends, interesting aspect here what we have seen PQR 4, 5, 10, 11, all 4, 4 by 1, 5 by 2, 10 by 3, 11 by 4 means 4 symptoms or 4 PQRs are only pointing towards the respiratory tract. How important is this? So, this is a very important respiratory medicine we have, and every kind of respiratory problem we have here could have multiple causes. Something to do with asthma at times, something to do with congestive cardiac failure, something to do with depression, mental excitement, and loss of secretions, which will act as irritant. Again, one more symptom is there in respiratory tract. It is PQR 12, 5 cough, dry, sibilant like a saw driven through a pine board. Worse by sweet, cold drinks, smoking, lying with head low, dry, cold winds. Worse reading, singing, talking, swallowing. Better by eating or drinking warm drinks. It is characteristic particular general belonging to the respiratory tract. And again, this kind of a feature tells you something like chronic bronchitis, chronic asthmatic bronchitis. Okay, we go to next symptom 13, PQR 13. This is sixth symptom, croup, anxious, wheezing, worse during inspiration, and if it is worse during expiration, please remember it is aconite. Worse before midnight, and if it is worse before morning, it is hypersulf. So we have now six symptoms. The tally of symptoms have increased. Now there are six symptoms which are pointing to respiratory system disorder and cough and croup. Croup is a acute disease, especially of children's. Friends, we go to CBS and there is PQR 14, palpitation, violent with pain and grasping respiration, awakened suddenly after midnight with suffocation and great anxiety, valvular insufficiency before and during menses. Now, this is a very important, beautiful symptom which overlaps two systems. Number one, respiratory and cardiovascular, because they manifest symptoms through breathlessness, also, anxiety, also. So, in combination, we find grasping respiration, and because of that, he suddenly gets up after midnight because of suffocation with great anxiety, but the cause is valvular insufficiency. The patient is already suffering from, there are valvular stenosis and valvular regurgitation. The patient is having valvular regurgitation. Commonly, regurgitation is a very advanced stage of the disease First, usually there is a stenosis and it is followed by regurgitation. So, valvular regurgitation, mitral valve is very generally, if you are talking about a female, if your constitution is a female, if your client is a female and young female, so rheumatic fever is common in female. And if the rheumatic fever is there, they bound to suffer from mitral stenosis. Initially, mitral stenosis gives the problem where we have symptoms only of mitral stenosis, systolic murmur, which is best seen in the apex. But later on, as the disease progresses, there is a mitral insufficiency and regurgitation takes place. So, blood regurgitate during diastole. When it regurgitates in diastole, Austin flunt murmur, and there is a radiation to the axilla, diastolic region. So these are the things clinically you should be able to understand and examine. Simply patient telling you this is not enough. What kind of a murmur is there? What grade of murmur is there? How much enlargement of the heart has taken up? Which ventricle is enlarged? You have to see whether because of there is a pooling of blood into the lungs, so there may be crepitations. Generally, you need to see the crepitations, but the strangely here, most of the time he tells lungs are dry, respiratory system is dry, there is a wheezing respiration, there is no crepitation. What does it mean? If the lungs are dry, then probably there is a mitral stenosis. And when insufficiency is there, definitely lungs will become basal crepitation you will find during menses, before menses, because the blood volume increases premenstrual phase, so there is a much more load on the heart. The heart is not even able to cope up with that kind of a thing. Heart goes into the failure, and this symptom, palpitation and getting up with suffocation, anxiety, is a sign of cardiac failure. So it needs to be understood what we are treating. Every case cannot be treated. He may require surgical intervention also. Now we go to the PQR 15, angina pectoris, contracting pain, heat, faintings, suffocation, anxiety, and sweat, worse after midnight. Worse after midnight, angina pectoris, it is a very serious condition generally. It is a coronary artery disease associated with this. So, in a female, angina pectoris is there. Generally, females are protected from coronary artery disease with the estrogen is there. Generally, it happens after menopause when the risk factor they become equal for the male and females. Anyway, you have to keep in mind angina pectoris, whether it is a stable angina or unstable angina. So while in rest midnight, it is an unstable angina. Unstable angina, anytime can be MI taking going to take place. So you have to take preemptive movement, preemptive action, like you have to evaluate coronary angiography and see whether they require bypass or they need to be given a stent. So you should be very open with their concept of treatment planning. Friends, we go to the relationship now. The spongia follows well after aconite, hypersulf in cough, and croup when dryness prevails. Please see, when dryness prevails, then aconite, hypersulf. After spongia, hypersulf, when mucous membrane rattles, means when the wet cup takes place, when the secretions takes place, the sputum takes place, secondary infection, yellow, white, green, please remember that you will have to go for hypersulf. Again, comparison is there. Arnica, causticum, iodium, lacusis, nux moschata. Sputa is loosened but must be swallowed again. Friends, let us go to the general modality. And here the aggravation. Ellen has not given any aggravation for spongia tosta, and we have found it ascending wind before midnight from boric materia medica, and similarly amelioration is also coming from boric materia medica, and patient is better while descending, lying with head low. Miasmatic correlation is also very important, and we need to have certain miasmatic markers for the tubercular diathesis points to pseudosora. If we talk about tubercular diathesis, we are talking about pseudosora, which is a mixture of sora and syphilitic miasm, where glandular enlargement points to psychotic trait, but then glandular enlargement initially, if they are going to suppurate, they can be syphilitic or they can be bacterial infection, and they go more in favor of pseudosora. But glandular enlargement which are not going to suppurate, they will remain strong, firm, like in cases of malignancy, in cases of sarcoidosis. So they are supposed to be psychotic in origin. Angina and valvular affections point to psychosyphilitic trait. It is a destruction of vital organ, internalization and destruction. Above feature points that the spongiatosta is a mixed miasmatic remedy, predominantly having psychotic or tubercular miasm. It depends upon the presentation. Friends, let us go to the posology, and doses should be 30 to 200 potency according to K. N. Mathur. He has been authority in materia medica. Please, if you have not read him, please kindly read him. Repetition. This remedy bears the repetition very well, and duration of action. If you are giving it in chronic disease, please, you have to wait 20 to 30 days. But in acute case, repetition can be frequent. Now we go to the clinical aspect, and here clinically we find this medicine is very important in case of anxiety state, sore throat, goiter, swelling of spermatic cord because of gonorrhea, maltreated gonorrhea, breath apnea, nervous cough, asthmatic cough, valvular heart disease, and angina pectoris. So, friends, thank you very much for your watching and kind listening. Please remember, sharing is caring.